Thank you, Ariel, and one time congratulations to this great event, to the great performance yesterday with Digital Medicine Week. We in Mainz know how much work it is to do such a big event, so great performance yesterday with, I think, much over 2,000 viewers here, and really happy to be part of this platform with our Compass initiative. So what is the Compass initiative? You mentioned it, COVID, the pandemic situation is one of the most struggling situations at the moment. And yeah, the Compass, the acronym stands for Coordination on Mobile Apps Best Practice and Solution Sharing. So it's yeah, in terms of PC language talking, what we want to build with 9 university clinics, a network which is funded by the BMBF here in Germany, is some kind of an operating system for clinical trials so that this can be captured by standardized apps architecture here. And I'm not only talking about code that is generated in this project, there is also content like checklists for data security, ethical standards, and so on. And this is only possible due to this really strong network of the university clinics, of the 9 university clinics here. And we are today very happy to be with the researchers and your researcher network here, showing our showcase the first time here in public, and happy to do so. Yeah, and with me again, as yesterday, is my co-moderator, Thorsten Gau. Yeah, Thorsten, very happy to have you again here in our virtual studio.
Yeah, Christian, thank you, and happy to be with you again. And I'd like to start with some very good news. And the good news is what we will see as part of Compass is already working. The base platform has been used to generate more than 80,000 data sets. And in our session, Q&A session afterwards, we will show it live. So make sure you tune in to www.healthcarehackathon.de/Compass. And before we go into this, another good news, 93% of the current users like the app, use the app weekly. But what it's all about, we will learn from Mrs. Kräfting, Mr. Prüss, and Mr. Gocke. And let's start the overview video.
Naja, es war ja eigentlich sehr schnell klar, das ist die erste Pandemie, in der wir mitten in der digitalen Transformation sind. Auch die erste, denke ich mal, Pandemie, wo man wirklich auch den Nutzen von Digitalisierung sehen kann.
Also gerade in Pandemiezeiten werden digitale Tools immer wichtiger, weil der uneingeschränkte Zugang zum Arzt ist ja nicht mehr da. Das heißt, wenn ich jetzt Menschen erreichen will und will denen medizinische Unterstützung geben, dann brauche ich sowas wie eine App. Wenn man solche Apps zukünftig schneller entwickeln will und nachhaltiger, dann braucht man genauso ein Projekt wie Compass, damit eben all diese Fragen einmal beantwortet werden für alle.
Digitalisierung in der Medizin ist natürlich jetzt vor allem auch in diesen ganzen neuen Technologien, Mobile Health, Mobile Sensoring, ein ganz wichtiger Aspekt. Und der wird einen riesigen Schritt, sage ich mal, durch die Pandemie nach vorne machen.
Und ich glaube, das ist ein hervorragender Weg, wie wir die Datenerhebungssituation in Studien nochmal auf ein neues Level heben können.
Uns sind besonders wichtig Aspekte jetzt, die auch neben der rein technischen Entwicklung von Bedeutung sind, nämlich zum einen ethische Fragen, aber auch Nachhaltigkeit. Die schönste App mit den tollsten Features nützt uns nichts, wenn diejenigen, die sie nutzen sollen, sie nicht nutzen wollen oder nicht nutzen können.
Wir wollen internationale Standards benutzen und wir legen diese Standards offen, damit jeder teilnehmen kann, das weiterzuentwickeln.
Das Compass-Projekt ist sehr international, wir sind sehr gut vernetzt in ganz Europa. Wir bringen die Ideen auch in die Europäische Union mit ein und die Gedanken und sind sehr gut vernetzt.
Ich denke, das kann man auf jeden Fall sagen, dass die Digitalisierung der Medizin Fahrt aufgenommen hat.
Es sind Plattformen schon entstanden, es sind technologische Entwicklungen schon entstanden, es sind viele Dokumente, die ganz neue Erkenntnisse hervorbringen. Also da ist ja kurzer Zeit sehr viel entstanden. Das Projekt funktioniert jetzt schon und das, was da rauskommt, wird auch auf die Dauer funktionieren.
Deutschland ist das erste Land der Welt, wo Sie Apps verschreiben können. Covid-19 wird irgendwann hoffentlich weggehen, die Digitalisierung nicht.
Dass 9 Unikliniker hier zusammenarbeiten, ihre Expertisen in den verschiedensten Feldern der App-Entwicklung hier bündeln und das dann eben einem ganzen Netzwerk als Open Source zur Verfügung stellen. Das ist, glaube ich, etwas, was in der Form nicht so oft vorkommt.
Die Kooperationen sind natürlich sehr wichtig und speziell nochmal zu so Partnern wie dem RKI, die uns auch an ganz vielen Stellen fürs Projekt hilft, aber auch für die weitere Vernetzung. Und das Gefühl, auch jetzt in diesem starken Netzwerk und dieses starke Konsortium, das ist ein sehr, sehr gutes. Also da wird das Kompass-Projekt sicher erhebliche Fortschritte bringen.
Und das ist genau die Stärke von Universitätskliniken, Versorgung und Forschung zusammenzubringen. Und das im Netzwerk ist eigentlich das Beste, was da passieren kann.
Yeah, we heard it, a strong network that has built in a record short time here. So we are able to react to such pandemic situations in the network of university clinics. And yeah, I think that's a good feeling in all this pandemic situation here. And so what's the topic or the Compass project about? So we decided to put this into 3 blocks. And the first block is on the question, how can you get data from all these different apps? If you have a simple question like, what's the weight of the average COVID patient, you're just able only to do it if you put the data in standards in there. And the second question, maybe if you want to get the health status of patients like every day, then the patient must be motivated to plug in his data in the app, so it must be usable. And indeed, that's the first topic we are dealing with. And let me again remind you, this is very interactive. We have now 1 hour view on our different topics, and then feel free to join in. We will keep that www.healthcare-hackathon.de/compass. So you will then land in a live Zoom session where you can ask the developers, where you can live see how the software can be implemented and everything. So it's highly interactive. So let me remind you on that one. So let's start over. Let's go to our first block. Our first block is the usability and international block. It's from Würzburg, Regensburg, and Ulm. And yeah, we have also a nice video from Rüdiger from Würzburg on that.
Unsere Aufgabe im Kompass-Projekt ist hauptsächlich in den Arbeitspaketen 3 und 4, die wir leiten. Das sind regulatorische Anforderungen, auch ethische Anforderungen.
Dahin zählt zum Beispiel Aspekte bezüglich des Medizinproduktegesetzes, aber auch natürlich Usability-Fragestellungen.
Da geht es vor allem auch darum, dass am Ende wirklich alle Personen in der Gesellschaft auch diese Apps verwenden können.
Da gibt es unterschiedliche Möglichkeiten, es anzuwenden, und eine wäre dafür der Einsatz von Eye-Tracking-Technologien, um mithilfe der studierten Augenbewegungen Hinweise darauf zu bekommen, wo finden die Leute ihre Informationen, beziehungsweise wo suchen Leute ihre Informationen in dieser App.
Also ein großer Teil ist da auch die Barrierefreiheit.
Wie, sage ich mal, schaffe ich es bei Mehrsprachigkeit immer noch die gleiche Funktion herzustellen? Wie kläre ich den Patienten zu Beginn möglichst gut auf? Den kompletten User Journey, wie man auch so schön sagt. Und da sind wir sehr erfahren, haben sehr, sehr viele Studien dazu gemacht. Vor allem eben auch dieser Punkt Evidenz, muss man schon sagen, ist was, wo wir verantwortlich sind und der auch sehr, sehr wichtig ist.
Der Reiz in der Forschung ist, glaube ich, immer, dass man etwas tut, was noch nie einer vorher getan hat. Also wir haben da jetzt die Herausforderung, wir müssen Pandemie-Apps schaffen, die für alle zugänglich sind, die für alle verständlich sind, für alle bedienbar sind, attraktiv sind, robust sind, die Regeln des Datenschutzes berücksichtigen. All das muss man alles unter einen Hut bringen, und das ist etwas, das hatten wir vorher noch nicht.
Also wir werden sicher, sage ich mal, einen Schritt nach vorne machen mit diesem Kompass-Projekt bezüglich technologischer Akzeptanz und auch Verbreitung. Die Kooperationen sind natürlich sehr wichtig und im Speziellen nochmal zu so Partnern wie dem RKI. Und das Gefühl, auch jetzt in diesem starken Netzwerk und dieses starke Konsortium, das ist ein sehr, sehr gutes. Also da wird das Kompass-Projekt sicher erhebliche Fortschritte bringen. Das Kompass-Projekt ist sehr international, wir sind sehr gut vernetzt in ganz Europa.
Und im Idealfall hat man wirklich am Ende von diesem Projekt ein Framework oder eine Pandemie-App, die in ganz Europa angewendet werden kann.
Und ich denke mal, dass das ein gutes Beispiel ist, auch für zukünftige Kooperationen, wo man zeigen kann, auch wenn etwas kurzfristig so Großes hier einschlägt, man doch mit geballter Power der Situation Herr werden kann.
Und wir werden technologische Entwicklungen und viele Richtlinien herausbringen, die uns für die nächste Pandemie entsprechend rüsten werden. Das Projekt funktioniert jetzt schon und das, was da rauskommt, wird auch auf die Dauer funktionieren.
Yeah, I'd like to welcome Rüdiger Prüss from University of Würzburg here with us. Rüdiger is presenting 3 universities in this work stream. That's Würzburg, Regensburg and Ulm. And Rüdiger, I heard that you are already producing some results. So results that are not only applicable for COVID. Can you tell us something about them, please?
Yeah, thanks for giving us the opportunity to being here, and thanks for your question of results that we already have gathered and collected within the first month of this Kompass project. Yeah, there are many results that we have created, but what is very remarkable for a moment that we have for many points and perspectives on ethical issues, on issues for the medical product law, and also on things how the usability can be improved. That we have, that we have created checklists with many new insights. How apps in the future can be developed using these checklists, and in the next steps, this checklist will be more elaborated so that in the end we have very powerful documents based on this checklist that can be used and utilized by companies, by other researchers, and many other interested people all around the world to create new pandemic apps for a new pandemic, or that we are prepared for new endeavors that are coming in this direction. So a lot of checklists for many perspectives and from many partners. We are very happy to have this already in this project created.
Okay, I see. I also heard that you are connected to the Robert Koch Institute, RKI, which is known for the Corona Warn app. So what is the connection here? How does your team connect with them?
We have already implemented one app together in the past before the Kompass project, and this was the starting point to come together in this project. And what is it's very important because they have not only the Corona Warn app, 2 additional apps are out there from the Robert Koch Institute that can be used in this context, and they have a lot of experience, and this experience is very important for us to create templates for data privacy, for user consent. This is the one direction we are using the collaboration, but on the other hand, and this is also very important, acceptance plays a very important role for this pandemic apps, and they are also very experienced in this, and we are working on research questions in the context of acceptance, and we are doing data collection in this context together, and also data analysis, especially with very contemporary methods like machine learning. And we are looking at data they have created and data that is out there. And acceptance is one important point, and also their experience, to bring these experience into templates that can be used by other researchers and interested people.
I see. So if
I was really stunned, I must admit that at that point, Rüdiger is really the network man here in the team. So we had a call, and he really knew someone from Google, as we had a problem with the Google App Store. He brought in this network from Ulm, Regensburg. And so Rüdiger, a really great compliment to the network you established and brought into the project. But sorry, didn't want to interrupt your question.
I was just emphasizing that you said acceptance, and acceptance probably means user acceptance, which brings me to think about what techniques do you use to understand the usability of your apps better? Is there something you can share with the group here?
Yeah, what we are especially using is, and there is also a long experience in other fields, we are using eye tracking. Eye tracking is a very powerful instrument to have a look at how people perceive things. And here a very large eye tracking study is done to learn more about how users perceive the Corona Warn app and similar apps. For example, to answer the question, how fast do I find the information, what is done regarding data privacy? Or is there any contact to other persons with COVID? Is there a fast access to this information, or is there no fast access? And this is something that is important for the user. And eye tracking gives you the opportunity to have a look at the glance of a person in a very powerful way, with also powerful data analysis methods. And this can be beyond questionnaires and things in this direction, instruments to have a better look and a more deeper look into the question how these apps are perceived. And we hope to find new insights. First preliminary results from a pre-study show that we will find interesting results. And we have a peculiarity here in this. There is a large acceptance study from the colleagues in Göttingen, and we can combine these results from the eye tracking study with their acceptance study. So we can combine things from different directions. So the eye tracking study is only one pillar in this acceptance endeavor, but we can combine this. And we also have a study out there in one of the already existing apps pertaining only to the Compass project, also only going into questions for acceptance. So 3 directions that will be brought together in the end to answer the question on potential questions on user acceptance. So very powerful instruments that will be utilized by us.
Wow, maybe a last question from me before I turn over to Christian. So if you say acceptance, usability, eye tracking, it rings a bell with me. Okay, what's with people that have less visual capabilities, color blindness, or see everything very sharp, but are intimidated using a touch screen? So are you also working on areas of accessibility for the non-perfect digital native user? Is there anything to share there?
Yeah, we are also working on this. There are also for disabled people. I think this is more and more important in the future, that we have on the one side the digital world, but this digital world is not tailored to many questions, to many user groups. And we have one particular task that is only looking at questions, and all the guidelines that all are around the world out there to bring more from the challenges particular groups have into the development of apps, into the screen design, into the user journey. What is the first step for a user? Are there any hints and tips for these users? And there is a particular task out there that is conducted, all the steps by the colleagues in Regensburg, and we are particularly considering this. So also this is a very important point within this project.
Wow. Rüdiger, great. And user journey, I think, is the key word. and maybe we can show the link again. So that's the keyword. You will be also in the question and answer session afterwards. So we have an audience out there, researchers that are interested in COVID, but also other topics, how they can adapt to our platform. And yeah, I'm sure you can give them some very good hints on how to do this user journey and how to use your checklists and so on in our question and answer sessions. So, Thorsten, didn't want to interrupt you.
No.
Rüdiger, thank you very much. Then, Rüdiger, see you in the question and answer session, and we are now handing over to IT and beyond, because I told you it's 3 blocks. We are looking at this topic, and as the name says, the beyond is all the soft facts. It's not software, it's data security, and besides data security, it's on data ethics and so on. And we are very proud and very happy that we made it to get Professor Dagmar Kräfting into our team here, into this network. She's also leading it with us. And she prepared a very nice clip from Göttingen that's talking about IT and beyond.
Uns sind besonders wichtig Aspekte, die auch neben der rein technischen Entwicklung von Bedeutung sind, nämlich zum einen ethische Fragen, aber auch Nachhaltigkeit.
Ich glaube, das Großprojekt der Digitalisierung wirft eben noch mal viel deutlicher die Frage auf, für wen ist es sinnvoll, wer macht was mit den Daten? Und ist es jetzt für unsere zukünftigen Generationen nur hilfreich oder habe ich als Patientin auch schon was davon?
Natürlich spielt Datenschutz auch eine ganz, ganz große Rolle bei Apps. Apps sind ja auf meinem Smartphone, was so mein intimster Begleiter ein Stück weit ist. Und die informationelle Selbstbestimmung ist da einfach wichtig, aber in beide Richtungen. Ne? Zum einen der Schutz der Privatheit, zum anderen aber auch die informationelle Selbstbestimmung, dass ich entscheiden kann, ich möchte meine medizinischen Gesundheitsdaten für die Forschung zur Verfügung stellen. Und das versuchen wir, beide Aspekte zu berücksichtigen.
Wir gehen dabei eben immer so vor, dass wir versuchen, diese ethischen Handlungsempfehlungen nicht nur sozusagen aus der Theorie raus zu entwickeln, sondern eben auf der Basis von empirischer Information, weil wir eben glauben, dass zum Beispiel Interessensvertreter oder Öffentlichkeit häufig auch wichtige Punkte haben, die wir in solche ethischen Handlungsempfehlungen integrieren müssen.
Am Ende ist das Wichtigste einer Pandemie-App, dass sie von vielen genutzt wird. Und die schönste App mit den tollsten Features nützt uns nichts, wenn diejenigen, die sie nutzen sollen, sie nicht nutzen wollen oder nicht nutzen können. Wir planen ja ein Open-Source-Produkt zu haben. Das geht natürlich nur mit einer aktiven Community, die das Ganze weiter pflegt, weiterentwickelt. Ich sehe absolut den Vorteil, diese ganz, ganz vielen Aktivitäten zusammenzuführen, zu vernetzen, wo wir wirklich gemeinsam an den Lösungen arbeiten. Und das finde ich halt das Tolle an dem Netzwerk Universitätsmedizin, dass das möglich ist, dass es da eine ganz, ganz große Bereitschaft gibt, etwas Dauerhaftes aufzubauen, sodass wir nicht beim nächsten Mal wieder bei Null anfangen und da genau die Strukturen, Lösungen, digitalen Lösungen auch nutzen können.
Yes, and with me in the virtual studio is Dagmar Kräfting. Dagmar, very happy to have you in our strong network as one of the leading partners, and very happy to have you here with us in the virtual studio. Very nice video, and I think you said one keyword that's really tangles all our audience from other research areas than COVID, and that's the topic of sustainability. And I think people are really interested, and I think this is one of your main focus topics. How can you operationalize sustainability? How can you get it into a platform? So you're the specialist, your stage.
Yeah, thank you, Christian, for the kind invitation. I'm very happy to be here today.
And actually the topic is very important for us because in our department we are developing loads of different IT solutions, especially research infrastructure that is meant for long-term, to support long-term research for patient registries. And we always face the same problem that typically these projects are funded for a certain period. And of course, when the funding ends, the patient data is still there and the patient registries are still there and it's useful. And we always have the problem, who's going to pay for it? And we all know that that IT systems really need maintenance and long-term maintenance. So we all see it in particular, and this is what I think is especially important for Compass. We see this in apps in a even higher frequency. So we all know, we all get annoyed that our smartphone is always beeping, that wants to do another update. And so we really have loads of new updates, and that's kind of annoying if you switch off the automatic updater. And on the other hand, it's even more worrying if an app is not updated regularly. So I wouldn't use it any longer, right? So we know that it's important to keep things alive. And so we all know that the current funding period is very short. It was just extended to the end of the year. And of course, we're not building that just for the COVID pandemics. But of course, we want to use it for the next, to really live pandemic preparedness. So we have to guarantee, or we have to try at least, that the solutions we develop are kind of live on a, let's say, low level of the pandemic. So we all hope that the pandemic is quickly over and we wouldn't need any longer this pandemic apps in the moment, right? So the interest in that will drop drastically, which is good. Yeah, we want to have our life back, but that
yes.
we need to think about what happens then.
Yeah. So as I understand you, I mean, one of the steps is the step we take, bundling forces, and so we invite all other clinics, not only university clinics, to get into the Compass network, because this will be a first step into sustainability, that we don't use our power to develop all the same platforms all together, but focus on the data and the studies itself. So if people afterwards come into the question and answer session where you and your team will be talking to our audience, what's the takeaway? What's possible for the audience to take away? Can they get checklists? Can they get publications? What the stumble stones are in most cases? What can you give?
Yeah, so I think the first very important aspect is that sustainability doesn't come just because you have a good project, you have good project results. You really have to plan it, and you need to think about that from the beginning of the project, actually. And this is what we are currently doing. So we just had a meeting today in the sustainability group to build this concept, to identify the most important aspects, to identify the most important cost factors, and and decide what would be a good direction that would fulfill our project goals and keep them alive, and to be able to guarantee that it will survive, or to at least try to. So, and I think one important aspect was also mentioned in the video is community building. We focus on open source software, and I think that's a very important topic. So we don't have a vendor lock-in. So if there's a new pandemic, everyone who wants can employ the framework and develop the individual solutions, adapt, but we give them the basis to do that. And very important is that your community and open source project is not only the individual, let's say, volunteers. They're super important. But if you look on how open source projects work. Most of them are strongly backed up by companies that use this open source framework and use the open source solutions. So for example, in Linux, it's Red Hat that contributes a lot to the open source solution.
Yeah,
so, and this is
very good point. So I mean, that's a keyword for our strong network. I mean, it consists not only of the university clinics, but it consists also of companies. We have on board Data for Life, IBM, and a company from the University of Cologne. So I think that's how our network is built. You had a second keyword in your clip with your colleague, and that's the topic of data ethics and ethics. We see situations, Dagmar, where people, share everything about Instagram and Facebook and so on, but if it comes to health data, where we could help and share data anonymously to help others, people think a little bit different about it. So also very interesting topic. What can you tell our audience on that one?
Yeah, I think it's very complex actually. So there was a Forster study in 2019 that actually showed that nearly 80% of the German population would be willing to share health data for health research. So, but in practice, we don't see that, and we have to. So there is a kind of acknowledgement that it's important that people would like to contribute. But I think the solutions we currently have are not good enough that you really have the feeling it's that you have the informative self-determination about your data. So typically you assign a consent and then give your data away, and that's it, and you hear nothing from the study. And I think this is where we try to get into, to look. So what would be the benefits for the contributors? How can we guarantee that they feel informed? That what are the reasons that people would participate or do participate? What are acceptance criteria? What are no-goes? And I think it's kind of individual, but there are trends. For example, you see it in the Corona Warn app, that trust, data protection, data security are very strong aspects in acceptance of such apps.
Great. Dagmar, I'm sure there's much takeaway and questions that you can answer in the question and answers session. So again, for our audience, the link, it's www.healthcare-hackathon.de/compass. So you will be live joining a Zoom session where Dagmar and our other colleagues, you will answer your questions, and we are happy to have you join our Compass network. As you heard, it gets stronger with every participant. Let's move our energy to the studies and not on developing those platforms, and that's the first step. So Dagmar, thank you very much for this insight, and see you afterwards in the question and answer session. And that's the keyword for our third block here, where it gets practical, where it gets hands-on. And that's also the nice thing on this project. The 9 university already developed very hands-on stuff, code, a web app and a native app that was developed and is already used in different clinical trials. We will have 2 very interesting guests from the Charité. We will have Peter Gocke, and from the University Medicine we will have Professor Wild. He's an active user, and we also prepared a small clip and happy to view it.
Also gerade in Pandemiezeiten werden digitale Tools immer wichtiger, weil der uneingeschränkte Zugang zum Arzt ist ja nicht mehr da. Die Charité hat die Ambulanzen eigentlich geschlossen. Das heißt, wenn ich jetzt Menschen erreichen will und will denen medizinische Unterstützung geben, dann brauche ich sowas wie eine App. Die Charité hat sehr früh mit einer Firma zusammen die Cough-App entwickelt. Das hat uns geholfen, Patienten zu beraten an erster Stelle. Brauche ich einen Test oder brauche ich keinen? Und wenn ich einen brauchte, konnte ich da sogar sofort Daten eingeben. Weil die Daten, die ich eingegeben habe, die konnte ich direkt von meinem Smartphone der Klinik übergeben, indem ich einfach das Smartphone zeige. Da war ein QR-Code drauf. Der enthielt komprimiert alle Daten des Patienten. Das hat auch die Tests deutlich schneller gemacht und auch sicherer, weil die Patienten eben nicht noch minutenlang da stehen mussten Daten ausfüllen.
Und genau den gleichen Workflow haben wir hier in Mainz übernommen, etabliert und über den Weg der App kann in der Gutenberg-Gesundheitsstudie eine einheitliche Datenerfassung stattfinden in einer Dimension, wie sie vorher einfach nicht möglich war.
Wir untersuchen hier eine Bevölkerungsstichprobe von insgesamt 15.000 Menschen regelmäßig auf ihre Gesundheit. Wir haben viele tausend Datensätze bereits erhalten. Das erlaubt uns, wissenschaftlich live zu sehen, wie die Gesundheitslage im Verlauf ist. Und diese Daten können wir permanent jede Woche auswerten.
Das Besondere an der App ist, dass sie auch mit Fitness-Trackern verbunden ist.
Das eröffnet uns ganz neue Möglichkeiten und dieses Mehr an Daten, auch das frühe Bereitstellen von Daten, hilft uns natürlich frühzeitig Erkenntnisse zu untersuchen, auch in Studien zum Beispiel sehen, wenn ich eine Intervention mache, ein Medikament gebe, ob etwas schief läuft, ob Komplikationen auftreten, sodass ich frühzeitig intervenieren und einschränken kann und nicht erst am Ende, wenn ich die Leute im Verlauf wieder untersuche.
Das ist eben die Rolle von Kompass. Wir wollen organisieren, dass die Apps, die sich so entwickeln, in einem Korridor entwickelt werden, der dafür sorgt, dass die Basis von allen gemeinsam benutzt werden kann. Wir wollen internationale Standards benutzen und wir legen diese Standards offen, damit jeder teilnehmen kann, das weiterzuentwickeln.
Ja, wir setzen keinen neuen Standard ein, sondern wir nutzen einen weltweiten Standard, der für den Bereich von Apps schon von einer weltweiten Community eingesetzt worden ist. Der Standard heißt FHIR, Fast Healthcare Interoperability Resources, und dabei geht es darum, dass man das Gesundheitswesen modular abbildet in der IT. Das heißt, wir können einerseits Daten interoperabel austauschen und andererseits auch gemeinsam Daten auswerten.
Ja, bei uns hat die Pandemie viele Digitalisierungsprozesse beschleunigt an der Stelle. Von daher ist das, glaube ich, ein positiver Aspekt und das hat uns weitergebracht als Gesellschaft und auch als Kompass-Initiative.
Das merkt man auch, da ist also so ein richtiger Spirit drin. Wir selbst sind innovativ, die Technologie ist innovativ und das, was dabei entsteht, ist was ganz Großartiges, Neues in Deutschland.
Das Schöne ist, dass alle Partner im Kompass-Projekt tatsächlich offen an die Themen herangehen. Und das hat alles dazu beigetragen, sehr viele Menschen in sehr kurzer Zeit zu gemeinsamen Zielen zu bringen. Und das erlebe ich als sehr angenehme Zusammenarbeit.
Die Medizin von morgen erfordert dieses Zusammenarbeiten, um die Erkenntnis weiterzubringen. Und das ist natürlich für Leute wie mich, die in der Forschung arbeiten, genau das, was wir brauchen, um weiterzukommen.
Wow, I'm impressed and I'm delighted. I'm delighted to welcome Dr. Peter Gocke. Peter Gocke is the CDO of Charité and happy to have you, Peter. Let's talk about streamlining the process. You told us about in the video streamlining the process at Charité with applications, with apps. Can you tell us more about that?
Definitely, and thank you for having me. I'm impressed too. So when I look back at the first times of the COVID pandemic, of course, Charité was quite early in the focus of attention due to Christian Drosten and his role. And so we had the challenge in the first weeks of the pandemic to give some support to the Berlin population. And this was only possible by quickly implementing an app, the so-called Cough app. That was just one single point of truth, and that's streamlining, where people can have a symptom checker, and then they are advised either to stay at home or to look for a test. And then, of course, more people try to have a test than the app advised them. So we had to cope with long lines of patients on our campuses that needs to be tested. And in the pandemic situation, there was a glass between the patient and our staff. And it was not that easy to have all those paperwork done in order to register them and perform the test. So we quickly expanded the COVAP just not only to capture all the symptoms and then form a very simple QR code to read that out through the glass, but also to capture the data of the patient and read that out through the glass in order to register the patient and perform the test. And that really paid off. So the first days, I remember, we had lines up to 250 meters long due to the distance you have to keep in the line. And that quickly was down to something like 10 to 20 meters. So apps were really helpful in starting attacking the problems that arise from the pandemic situation.
I see. I like your metaphor corridor of apps you had in the video. So I want to borrow that one later on. But if we talk about those corridors, how do we define the direction of the corridor, making sure it's not too wide, not too narrow? Is there anything that can guide us in this direction?
I think we should be guided by the target. And so the target was still to capture data and to allow the patients to be tested, for example, and to preserve that data. So everything what's nice around that is nice, but you don't need to have it. So really focus on your target and then use a minimal viable product to collect that data and work on it. And that was the guidance even for the next iterations of the COVAP and others. And of course, you have seen quickly spreading lots of apps around, but they are have been very limited in their focus and have a very small audience that use that app. So you really need to work on a platform so that the one app or two of those apps can deliver their data towards a platform. And I think that's the best approach. Decentralize the process of capturing data by using an app, but for using the data, you need a central platform where all these apps have to deliver the data to.
I see. If you say all plats on a platform, I remember an old commercial. I don't know which telco provider it was, but it was like a bridge that met like this. So which standards can help us to that it wouldn't happen? I heard Sylvia Thun, also professor at Charité, talk a lot about FHIR. Can you tell us about what FHIR is? How does it help?
Well, Sylvia is brilliant, isn't she?
Yes.
So she really lives up to interoperability and standards. And that's the key issue behind that. So FHIR is a technology where you really can work with simple technology on collecting data in a structured manner. And one of her initial tasks was to form the GECKO, the German Corona Consensus Dataset. This was really a very quickly implemented FHIR resource open to the public, where every aspect of data relevant to the pandemic was described and you can use it. And FHIR, to my knowledge, is a standard that has been adopted so much quicker than every other standard in the past to the healthcare community that we really set on things like FHIR, SNOMED, or LOINC. So those standards already exist. You need people like Sylvia helping us in the Compass group really to make use of those standards.
You mentioned SNOMED, and I saw Sylvia tweeting about it. So is this a competing standard? So is it either FHIR or SNOMED, or how do they relate to each other? Is there
no,
any
I think
connection?
It's a universe of standards that are working together. So of course you have FHIR as a technology to work on that data, and it even brings mechanisms to transport data. And in those standard SNOMEDs, you have the code and the terminology you use to describe something, which is very similar in LOINC. And all those pieces have to be put together to form a platform of standards and interoperability to make those data management happen that we need. And that's one of the strengths of Compass, that there are a lot of people know about all those standards and what they can be used for, and brings them together in a perfect manner.
Okay, so if I get you right, FHIR is more like the letters and the words we use to communicate between systems, and SNOMED is then the language that gives meaning to that. Like, okay, is this heart rate or pulse, or is this temperature, and do we use Fahrenheit or centigrade and stuff like that? Is this more or less right if I say it like that?
Yeah, that's a very good picture, and I think it's a much better picture than all those data lakes other people talk about, because if you put something in a lake, you won't find it back probably.
Yeah.
So those structures are really key to success. And if you look at the German healthcare system, it's lacking the use of standards like those. And the capability of the German healthcare system to manage and operate on high quality structured data is poorly developed. But that's what we see in the aftermath of the pandemic, that the German government is pushing the healthcare system to use more standards and to work on platforms like the telematic infrastructure to bring this data together. And I think what we learned during the pandemic, we need to use this data. So we need to enable physicians, but also patients to collect that data and to deliver it to the place where it should be used. And this is the reason why I think that Compass and its results will survive even the next 10 pandemics, because that's the way digital medicine of the future will happen. The combined, the use of structured data in real time.
I see, yeah. And yeah, we are using FHIR already in Compass. So the app that Christian mentioned is using FHIR as the exchange format, and the next step is to take the answers out of those questionnaires and transform them into SNOMED code, Loin codes, map to Gecko. And I think, echoing what you said, it is really the foundation for researchers. So is there any advice you would give to researchers outside Charité, what they should apply so to improve their research? Any message to other universities that are not part of Compass yet?
So first advice would be part of Compass, because what's delivered with Compass is open source. And I think open source is a very good direction for the healthcare system to deliver those solutions you find in an open source manner, to make a combined use of that. And once it's open source, you are really master of your data. And that should be the goal of everybody of us, not have our data stuck in silos delivered by healthcare vendors, but to use open source data structures like Gecko, like Compass, like others, which are rising around, to really make worse and benefit from the data people give us.
Yeah, and Peter, I couldn't agree more, and I would love to continue the chat in the question and answers, but I think I need to turn over to Christian and say thank you for being here with us in the studio, and talk to you later. Thank you.
Thank you.
Thank you very much. So very good keywords, and I think today is also the point where we can start to widen this network. We have a big audience here, researchers from other disciplines than COVID, and the network can get even stronger if we get other studies, other trials on it. So be sure, be part of our question and answer block here. One of the key things is using the Compass platform here in practical studies. And we're very proud here in Mainz that we made it with the Gutenberg Health Hub to implement Compass already in different studies. You saw it in the clip in one study, which is setting on a big longitudinal population that we follow here in Mainz over years, was the MyMobile app, where we collected already more than 40,000 data points. And you saw it, it's connected also with a fitness tracker. And I'm very, very happy to have our head of the Gutenberg Health Study here, which is a big longitudinal study. And yeah, he can give us some keywords. He can tell us something about how it is to use the app in a practical environment. Okay, so I hope we have you here in our virtual studio. Philip. Yeah, great. So it worked out. Fine.
Yes. Hello, Christian.
So Philip, we are very keen on after some theoretical checklist stuff and so on, really now to hear how does Compass feel in practical use. So you made two big studies already. It's in daily use, and yeah, we are very interested in hearing something about that.
Yes, thank you. So indeed, we implemented two apps via the platform in two larger projects. One is a population-based trial in COVID-19, which we set up. It's 10,000 individuals from a larger cohort of 15,000, which we are already following over 10 years now. On these individuals, we have a multitude of data which is on clinical information, clinical investigations in a 6-hour exam, about lifestyle, environment, and also a lot of molecular data. So these multi-omics data from the genome, epigenome, down to the proteome. And we use this data now in the COVID-19 trial to assess what the impact of the pandemic on the population health is. And within this project, we also used an app with which we ask the participants to enter data about their health status, about the testing status, about a positive infection or the course of an infection, and send that to us on a weekly basis. And this allows us to monitor the situation on the local population lively in a dashboard. The other trial which we have is a clinical trial, an interventional trial, where we want to bring people into physical activity, people with heart failure, most common cause of hospitalization in Germany. And there we have an app which is connected to a fitness tracker where we can see how active the person is every day, and the individual gets a feedback. So how good was she or he in being active? And the app gives advices, what to do, what to change, and also answers questions. So it gives a possibility to interact with the individuals. And in both trials, I can only say very well accepted by study participants and a very helpful new tool.
Great. So, yeah, the Compass platform is alive. Happy to hear that it works so good in practical use. And you told us about lots of data. You told us about proteomics, that is the omics data that is integrated. And you have a big population of a longitudinal study with the Gutenberg Health study. Can you tell us something more about this really huge data fund you have?
Yes, so the basic idea behind is that most of the diseases which we develop in the population are a result of the interaction of an individual with his environment. We all have a genetic predisposition with which we start into life, and then the further course of our health depends on the interaction with the environment and everything around us, from conception to death. And this can be assessed nowadays. And going along with that, the technology developed to molecularly map a person. So we can see all the different molecular levels and take them into account in all this environmental information on the individual. And that helps us to better understand the course of a disease in each individual and better understand why diseases behave so differently from individual to individual, and we can identify subgroups who behave the same direction. And the overall idea is to get more tailored, individualized medicine therapy for the individual.
I like that example very much, Philip, because I think it's a perfect bridge to our audience. I mean, it was the use, or is the use of a app for COVID pandemic situations, but you already use it in a much other setting for mobile. So you already adapted the platform to a completely other topic. So can you give us a sneak peek? How long did it take? Was it a big time process, or was it fast?
No, indeed, that was really fast. So with our partners, from the Gutenberg Health Hub, we set that up in a few months actually. So this was configuring the app specific for our needs, of course. Also the interactions with the devices which are connected to the app, which is not just a fitness tracker, but also a heart monitoring, a blood pressure monitoring, etc. That was a little bit of a challenge, but in the end, we are talking about a very few months, including all the regulatory requirements which had to be met to fulfill what has to be done to conduct clinical trial, which has high regulatory requirements.
So maybe last question, your view into the future. What do you think? What impact will those app technologies have for clinical trials in general? How will they change the system? Is there any way you see?
Well, I think, of course, this development is really a booster for clinical science. So we are much closer to the study participant, to the patient. We can directly interact. We can lively get information from the individual, which we can look at, and we can intervene at an earlier stage, not just waiting when all the data are in, like just outlined. I think that will change the way we work, also the options which we have. On the other side, of course, we have to see that there are some obstacles, some challenges, which I would say data safety, data security is a topic which we always have to work on. And another thing is thinking of the elderly. The new technologies are kind of complex sometimes in use. Also things like just vision is something which deteriorates with older age. And therefore we still have to adapt and find ways how we can use these technologies in, especially, for example, elderly, also, or maybe also people from abroad. But I think these are all things where we learn from day to day and which will be overcome. And yeah, as summary, this is a boost for science.
Great. So, and nice keyword, as you said, there's the link again to usability with elderly people, how to use it for a study population. And I think there's also a big good link we can do from Compass. It's a link to the medical informatics initiative. We talked yesterday in preparation for this talk here, and we have the luck that we have the Miracom initiative here, so all this connecting to omics data and so on. I'm sure we can also share it as an open source. And Philip, I think you are also in our question and answer session afterwards. And yeah, I'm sure that, or I hope and I'm sure that other research initiatives will join us to bundle forces on this platform and then focus on the studies themselves. And together we can build a stronger network. So Philip, thank you that you've been with us in the virtual studio here. Thank you and see you.
Thank you, Christian. Bye.
Okay, so Thorsten, then we too are alone, and yeah, we can give the audience a little outlook maybe on what they can expect in the following question and answer session. Here you already told us it's not only getting some PowerPoint and data stuff, so it's really implementing, as I understood you. So people can really, did I understand that right? They can get the app, put their logo in there, and then you compile it and show their app to them? Is that really what we do?
Exactly, Christian. So people joining the Q&A can use the time to speak with our presenters we have seen right now, or we will probably go into breakout rooms, and one of the breakout rooms will be a live demo doing just that. We will start from the back end, install all the stuff you need on your server and your little data center, could be a laptop, could be in the cloud, wherever, and then we will modify an app. So we will start with the generic NumCompass app, and we will update it, the look and feel towards the Minds colors, and we will have the app live with a questionnaire, and then we invite all the people to a community. We will use Meetup for that. So then invite for further on topics. So setting expectations. It's ready to use. You will see it live. You can't use it on your own in the next hour. You need a little bit of preparation. But to get prepared to that, we will invite you to our Meetup that will be set up in March. So we are ready to go. We welcome everybody. If you are a technical guy or girl, join us. If you know how to do studies, join us. If you just want to see it, join us and have a lot of fun. And see you there in the question and answers, www.healthcarehackathon.com/compass.
Thorsten, it's unbelievable that you're talking about technology. I mean, you're talking about fun, and I really can say it's really working with this team. Is fun, and I think that's also one of the components why Compass is so successful. So thank you to all the team, to all the 9 universities which brought their input to our network. It was a great fun moderating this, co-moderating this with you. I'm looking very much forward implementing this great project and rolling it out, and that's why the point today, rolling out to other research communities and meet them after the session. So great. And yeah, I think I give back to Berlin. Thank you and many greetings to Berlin. Great event, Digital Medical Week. We will be with you next time if you like to have us. We are very happy. Great event. Thank you and bye-bye to Berlin. Bye.